This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Hormone imbalance that women have that stops them getting pregnant is polycystic ovarian syndrome. It is common because 5% of the female population have polycystic ovarian syndrome. Up to 20% have what are called polycystic ovaries, and they don't have the syndrome, but their ovaries carry these multiple follicular cysts, tiny little things in the ovary. But the polycystic syndrome itself is not only the ovaries showing this picture, but also of having symptoms, which most commonly are irregular periods, somewhere between 35 and 50 days. But even women who go 32, 33 days may have polycystic ovaries and may not be ovulating every month. Polycystic ovarian syndrome doesn't stop a pregnancy occurring. We see lots of pregnancies in women who have had that diagnosis because ovulation still can occur, but it's irregular. Some months it is and some months it isn't. But probably more importantly, when that ovulation occurs is particularly irregular, because if you have a cycle, 1 month is 28 days, the next month is 40 days, when did you ovulate? And when will you ovulate in the next cycle? No one knows. The cause of polycystic ovaries is actually still unknown. It most likely starts during the programming between the brain and the ovaries around the time of puberty, and that for reasons that we don't understand, the ovaries don't respond appropriately to the brain hormones, and the brain hormones don't respond to the hormones coming from the ovary. If we intervene to change the messaging that goes on between the ovary and the brain, we can control it, at least on a month-by-month basis. It doesn't change it forever, but while taking medication, something like 80 or 90% of women can be made to ovulate on a regular basis. And these are simple medications. In the past, we used a drug called clomiphene. It's had some side effects for some women. We've got simple treatments for the majority of women with polycystic ovarian syndrome. Polycystic ovarian syndrome has other symptoms like excessive acne and increased hair growth. Again, there are things to do. We can deal with those by giving appropriate hormonal treatment. But in terms of infertility, I have to say, of all the patients that come through my door, if they tell me that they are having irregular cycles, PCOS is most likely diagnosis, and I know that I'll get a significant number of these pregnant without having to go to IVF.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.